took a gummy. It's Canada. It's legal here. Ugh, man, there's so much in my brain that I want to say sometimes, and like nothing. More like there's so much emotion. It's gonna come out. And I'm just so good at stuffing it. Most things about my trauma feel really unexplainable. Like, it feels like it wasn't that big. Like, it feels like it wasn't that big. That's what my mind tells me. And yet, it was devastating to me. So it's hard for me to even talk about, like, but there are some things I can talk about. I'm back at work and not fully functioning. I have a stressful job. And we were talking about mental health and the MAID process. MAID, Medical Assistance in Dying. And we're just chatting as a group, some of us, and they were like, oh, the one guy was explaining, oh yeah, they're changing access. Mental health, people with mental health used to be, or aren't currently eligible for MAID, but that might be changing. And I was like, oh, actually it is changing. It's changing in March. And I was like, oh, okay. And somebody else was talking. She was looking it up, actually. She was Googling it. She's like, oh, you're right. And sometimes my mind just gets racing. And it's funny because, and I wasn't like this before my traumas, but I'm like this now. And it's like I can't stop it. I'll cut people off and I will just like, I've set such a huge need to like say whatever it is I'm thinking. I need to get it out and I need to get it out now. And I'm pretty sure I seem like an asshole. Or not an asshole maybe, but just like a little bit inconsiderate. And I said, I know that because my friend was waiting to do that. Like, I didn't know. She didn't tell us. Well, she mentioned it offhand to her daughter. And she would talk about it. Not like deeply, but anyways. And last year, and they changed it. They canceled it. It was supposed to be March of last year, that if you had mental health issues, you could get MAID. And I said this in this group of us new employees. I said, well, I know that because she was waiting for that. And when they changed it and canceled it and pushed it back a year, she took her life. And I'm sitting there in this group of new people, and I could feel like emotion welling up. And it's just like, you just push it down because like we were training, right? And hold on. Just wouldn't be a video if I didn't snot on myself a little bit, right? And honestly, even now, it's like, it feels better to just like let the emotion out. But I think my logical mind is telling me that it's like, oh, you're fine. It doesn't affect you that much. And like, she, like, all these logical things, like, she made a choice and that was her choice. Like, not that it's not sad, but I do often feel like all those things are true. But the thing is, in the moment, I'm definitely fucking sad. And I feel like if I start crying like this, it'll be like the end of the world. Like, for me, I think I really learned. It's like, I come here and I can do it, like, so easily, but I can't do it with people. Because I'm just, like, too embarrassed. Vulnerability is not weakness, but I think I've just, like, learned from culture, from my family, from their own traumas, that it is. And, I don't know, I was just thinking about it tonight, and I'm like, that was one area when I could have just shown a little bit of emotion. But it's like, I feel like it's like a fucking floodgate, which is why I push it down, because I have so much inside of me. Because I just had like the stress of the day of being new. I'm so stressed. It was okay Monday, Tuesday, Wednesday, and I started losing it Thursday, Friday. And, there's so much stuff to vent about. I've done this a couple times. I did this another time too. Afterwards, I was like, oh, I could have opened up a little bit. I could have been just a tiny bit more genuine. But it feels terrifying in the moment. And they were like, it was kind of in a formal atmosphere and whatever, so there wasn't like time to chat. So I just like blurted it out, and then the guy who was training us was like, I'm really sorry about your friend. I'm like, thanks, it really sucks. And I don't know, where did it all go wrong for me? I was a healthy, happy 25-year-old when my shit happened. And I still feel like I was too old to have trauma. I was too old to change so drastically. But I wasn't. I was actually really young. Hold on. Sexy, isn't it? I watched a video on YouTube tonight, and she was really such a powerful speaker, and she was talking about complex trauma and how creating really has been an outlet for her. I agree with it. It's just like finding motivation to do anything when you're depressed. It just feels like too big of a boulder to move. Oh, my life. Okay, I wanna complain about one other thing. This thing's always on my mind. I'm like, I've had so many therapists. So I have one now, and I'm just like, what are people thinking? What are people thinking? I understand, like everybody has their level of traumas. Like, really, I do think everybody's had some, because we're like a traumatized world and culture. I heard somebody say that, and I was like, oh yeah, absolutely. We're kind of a damaged culture. Anyways, so these things happen easily. And but I'm like, there are different levels of severity, and if you haven't been there, you don't know what it's like. And sometimes therapists, I think, like, they have all the best intentions. Really, they do. And this one that I have, I actually really get along with her. And 100% she has the best intentions. And she's not as crappy as, I mean, she's not crappy. She's not as, yeah, I'm going to say she's not crappy like some of the other ones I've had that just are just like fucking, just like the one I had before that, who I had very briefly because I kind of fired her. Just like horrible listening skills and like nice person, but nice person is not enough when you're dealing with somebody with complex traumas. Anyways, but even the better one, the current one I have, she's just like, oh, you should not go back to work yet, and until we've had more sessions and you're like more stable to go back to work. Like, I don't get it. What do people think? So I've had a few sessions now. I'm like, I'm not changed. Like, don't get me wrong. It's nice to feel validated and nice to like have somebody to open up with. But my symptoms and my issues have not changed a lick in 20 years. And like, I'm not exaggerating. I'm really not exaggerating. So I'm like, yeah, I can blame myself, and for sure I have not forgiven myself, and for sure I have not you could say work through my trauma, but like, I'm the one that needs help, and the system, if you ask me, there's a whole bunch of me's out there, and there's a whole bunch of me's out there. And I go to a drop-in group sometimes, and oh man, we're all fucked up. All of us. Like, pretty badly. And just because you can go to work every day and do the things you need to do to survive doesn't mean you're not really depressed and really anxious. And it just drives me crazy that just like the whole therapy system, the whole mental health treatment system is so, I would say, like, not even broken, because that means it was intact at some point. I'm just like, it's so insufficient for people who have, like, I actually think, like, I remember thinking about pre-trauma. I had never been to a therapist, and but I knew I was in social work, actually. So, you know, I had therapist friends and all that. And I think I knew I had issues like every normal individual. And I remember thinking like, oh, maybe, you know, it'd be nice to like talk to somebody and like get better idea, like just like, you know, a little bit of help and like a little bit of, I actually think if I would have gone to therapy back then, I would have gotten more out of it. It's almost like there's a level of severity of issues that the current system just does not address very well. Actually, you know what? The shirt that I'm wearing, this is MAPS. It's the, I don't remember what they stand for, but it's like psychedelic therapy, and it's the one that's actually like, in phase 2 and 3 of clinical trials. One of them for PTSD. So actually, I really researched it, and I actually really wanted to get into it, but it's not in my city, and you have to live in the city that because you can imagine how many thousands of people they want to get in, and like 12 get in, or 20 or something like that. Anyways, they have a control group, right? So they have a group that gets the therapy without the psychedelic, and it's really intense therapy. It's like, yeah, it's super intense. And then if you're in the experimental group, you get the MDMA. Anyways, so they took people with really complex traumas, and I thought this was a really, really good baseline for if you have really good therapy, like what the difference was. Some people don't respond, so I feel like I'm actually probably in the non-responder category. Anyways, and the control group, it was like 25% of people got better and actually didn't no longer met the threshold for like PTSD. And it's somewhere like somewhat depending on the therapist, but it's somewhere between like 60% and as high as 80% in the experimental group. So there was something about like the MDMA that really allowed people to open up and talk about their traumas, and for certain people that really worked for them and helped really bring them out of their PTSD symptoms. So, but yeah, it was like really intense therapy, and I personally think, yeah, so that 25% with really, really good therapy, and like really, it's not even just the therapy. They were in this program, there's all this motivation, there's all this like support from like clinical people that I think actually plays a role in how effective something is. So anyways, they had all these things, and even then, like 25% is a really low number when you think about healing. And that's like kind of top of the line, I think. So if you compare that with like everyday therapists, like, I mean, if you've been to a therapy and seen a lot of there are a lot of bad therapists out there. And they're all really nice. They're all like really nice and well-intentioned, but just like they haven't worked through their own shit, and they probably haven't gotten the support they needed. And I've just had so many experiences where I'm just like, I can't believe you said that. I cannot believe you said that. Yeah. I'm definitely frustrated. I've had long-standing frustration with the system. You know, and some people might put the blame back to me. Certainly I do, actually. Like a lot of the time. I'm like, I'm the screwed up one. It's not in the system. But then I also think our system is like, it's inadequate. It is absolutely inadequate for people with complex PTSD. Like maybe they're helped a little bit by this and that, but I've never, I mean, I can only speak for myself, and I've never really been helped with much of anything. I don't know, I guess, you know, 48 now. I'm 48. I'm 40 fucking 8. And, you know, I'm probably gonna live out the rest of my life with this just constant struggle, constant battle. I'm also constantly trying to still try things, and, I don't know. I guess I come here to just, like, get it out, find some sort of way to just, like, get it out into words, into the world. So there you have it. And it's like, how many times I'm going to pound my head against the wall trying to get something out of therapy that clearly hasn't worked for me. And yet, it's like, I don't know what else to do. Like, what else is there? I mean, part of me is like, yeah, I gotta take things into my own hands and do things outside of the box, outside of therapy, creative things, or like expressive things. I mean, I do think that it's just hard to do. Anyways, I guess that's it. Bye.